Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. And you listen me every day on Sabarang radio station, on YouTube, Facebook media, and on alternate day. You listen me on Radio Pravas and different other radio stations time to time. But it's regular on Sabarang radio station, YouTube, and Facebook media. And we are discussing just like a series of lecture about the life, how this life was created, how this life was developing, what are the different stages, how long he lived into the mother's bubs, and after that how he comes out. All these stages, step by step, I have described everything. And after the birth, the different stages this life has passed, different diseases it has suffered from, and different other situations he has crossed until it becomes adult. And after it becomes adult, we have started that yes, this whole body has different functions. And for the different functions of this body, we have different systems. And every system has a different organs to perform various different functions in the systems to complete the system. In this way, ultimate of all the systems, ultimate of all the organs is a cell. The minimum single unit which is considered is the cell. And cell is responsible for all the activities which a organ is performing, which a system is performing, which a whole body is performing. It all depends upon the activity of the cell. And activities of the cell depends upon the organelles inside the cell. A cell is composed of membrane, cytoplasm, and various other organelles inside the cell. And all those organelles inside the cell or inside the cytoplasm are responsible for various different functions. And it does not mean that only one cell, but it means that the whole body, the trillions of cells of the bodies are performing in a similar way their functions, and ultimately the joint action of all the cells results in a normal life. But if there be any change in the normal routine of the life, it means that somewhere some cells are not performing the normal duty they are assigned for. In this way, we have to trace out what is going on. And one thing we have already declared that it's not only the individual cell will be affected and it will remain individually infected. Not at all. The cell, all the cells of the body are working together, cooperating to each other. It's a different thing that the closest cells are having more effect. If one cell is damaged, the closest cell will show the more effects of that damages which one cell is showing you. In this way, the far away cells may not be showing that kind of symptoms, that kind of problems which we are perceiving from the diseased type of cell, diseased type of organs. But it is not that they are not having. Yes, they are having. They are having but minimum effect of those damages, because all the cells are cooperating to perform a normal life, to maintain a normal life. And if someone cell is not performing the normal life, and all other cells are cooperating to it, but even then, if the cell is unable to perform the normal duty, means it becomes sick. It means that all the cells are having more or less effect of that causative factor which is damaging the function of one cell. So means all the cells are cooperating with each other. And many times I have given the examples that if there is any death in the nearest relatives, all the nearest relatives, they feel it. They feel the sorrow. But ultimately, the distance of the relationship between the dead persons or the relatives of the dead persons depends, and the sorrow, degree of the sorrow, depends on the distance of relation with that. It means, similarly, the whole body. If one cell, just like I can give you example, if there be only one just boil tiny eruptions on our finger, and we feel feverish, we feel tired, what does it indicate? It indicates that though this eruption is on the fingertip, but it has involved, or the whole system has been involved with this finger. As far as its relation is concerned, it is not only the individual cell, though the eruption has produced only on one cell. But ultimately, this is the effect of a united effect of the whole body, united effects of all the systems working inside the body. More or less, every system shows this thing. Just like small eruptions on a finger or on one organ, and you feel feverish, that feverish is the indication that the whole body is feeling that. Whole body is cooperating that. All these things. And the same way, we have described to you that, yes, we will describe each and every organelles inside the cell which are working, and we can say the cell is working normally. And we are discussing also what are the assigned duty to the different organelles inside the cytoplasm. And in this way, if they become sick, if any of the organelles become sick, as we presume, that only one system is damaged, and we just treat that system, as we think one organ is sick, and we try to focus our treatment on that organs. This is the folly of the treatment system at this prevailing in the system. But even then, whatever it is, I have to explain those things. Though the concept of the homeopathic is different from this one. But anyway, what language, what concept you understand, I will like to explain you in the same way. So you understand that one organ is damaged, then the function of that organ is damaged, is not functioning, because of the damaged function of one organ of one system is not allowing to perform a normal function of that whole system. In this way, the whole body, ultimately it will go through the whole body, and whole body will feel sick. So so for that, to analyze this thing, or to reach to the conclusion, ultimately I have started the lecturing all the organelles, their name, their situation in the cell, their function inside the cells, and if they are sick, and if they are damaged, how they are damaged, and if they are damaged, what type of symptoms it can represent inside the whole body, because we cannot see the cell microscope. It's a microscopic organisms, and we can see it only the microscope. But when one cell or the most of the cells of the body or of the organs are affected in this way, ultimately the symptoms are represented by the system, by the organ first, then by the system first, and then by the whole body. As a whole, we feel sick, we feel tired, we feel weak, we feel appetite loss, and many other symptoms, we start feeling like this. It means the whole system, whole body, whole life represents the changes inside the cell, changes inside the organelles of the cell, or any organelles of the cell, you can say. In this way, we have started discussing each and every organelles inside the cells. And previously, we have discussed about the cell as a cell membrane. We have given description of that one. And if cell membrane is damaged, what will happen, how it happens, and what will happen, what are the signs and symptoms of those things, all these things. And after that, we have discussed about the cytoplasm, the all inner environment of the cell. We have discussed about that one. And if that one is damaged, then what will happen, and how the effect, how the functioning of the cell inside is damaged. And this is all depending upon the cytoplasm of the cells. All this thing has been described. But here today, I was supposed to describe the other organelles of the cell. But the questions came. So, as I told you, if there be any questions of any listener, first of all, I will attempt those questions and explain those things, and then this series of lecture will continue. So, this is what till now we have reached to the series of lectures that a cell has many organelles, and every organelle has a different type of duty assigned by the nature, and they are performing that. And if they are unable by one or the other reason, because we will discuss the reasons behind one or the other reasons, if the function of any organelles inside the cell is damaged, it means whole body will see that, and whole body will feel that, and it will represent by the symptoms, by sensations, by feelings. Means some of the symptoms will be the subjective symptoms, some of the symptoms may be the objective symptoms. And objective symptoms we observe, our objective symptoms we trace like a lab test and all that. But some of the symptoms are subjective symptoms, which only the suffering people can tell. The suffering person can tell that what I feel. So here in homeopathic concept, we give more weightage to what the patient is saying, whereas in the allopathic style or with the other medical sciences, they give more weightage to the objective symptoms. And their limit of treatment is also up to the objective symptoms, whereas our limit is more deeper up to the cell. What were the reasons? What were the causes? They have caused this thing. So we go to treat all those things later on. So, because your question has come up, so first of all, before going to the detail of the other organelles in the cell, I would like to explain your questions. It is regarding the cancer. Simple. A person was asking me, do you treat cancer? I heard you are having many more patients of cancer and you are treating cancer. I said, yes, as you heard, it's right. But I do not treat cancer. I treat the personalities. One personality has many more symptoms, and one personality has one body, and in one body there are nine systems working to produce a normal life. And at one place, at one time, more than one systems may be damaged, may be suffering, may be not producing the normal functioning of which is required for the normal life. It means in each individual system, whatever is not normal, whatever is wrong, and the different doctors will prescribe the different medications and will give their opinion about the individual system, not the whole and individual life process. So, if you go to the lungs doctor, he will diagnose and give name to the symptoms which are produced by the respiratory systems. If you go to the heart doctor, they will perceive the symptoms which are concerned with the circulation and heart, and they will diagnose and give name to some of the symptoms. as a heart concern. Some are, is just like the GIT, gastrointestinal tract, and the urinary systems, and various other systems. So whenever you are sick, and there are different type of systems involved with the disease, and then you go to the different doctors for GIT, for respiratory, for circulatory, for urinary, for different systems, and there are different doctors, and then they give their own name to some group of the symptoms. Whereas similarly, they give name to the cancer. Whereas in homeopathic systems, we do not give name cancer. It's a change of tissue. Even in normal condition, a cell is changed. When it becomes sick, it is changed. And the first change of the cell is known as inflammation. And if it is not recovered within that stage, it becomes degeneration. And when at the degeneration stage, it is not recovered, it is called necrosis. And when the necrosis is not controlled by any means by the internal power of the life or by the other medications we are giving from outside, if this necrosis is not controlled, it may convert it into gangrene, part dead. In this way, the cancer is treated, because it's not only in one organs. That one doctor will say, oh, it's a kidney cancer, or it's a lung cancer, or it's a this cancer, or it's a stomach cancer, all that. But they are reaching now to this extent that many organs may show signs of deterioration of the cell, signs of which are not normal pattern of the normal cells, because there is a normal pattern of the development of the cells, how the cells are growing, and there is a limit of their growth. Just like my finger, you see that they have their different heights. The same way, even if finger is damaged, something happens, and the new structures develop inside the fingers, ultimately it will stop its growth at its normal genetic character. At its genetic character, no, it's not possible that the index finger will grow more than my genetic character and more than the middle finger. No, it's not. In this way, that is the genetic character, that every organ, that cells of the every organ, cells of the every systems grow in a normal pattern under a certain limits. They do not grow beyond that limits. This is the normal criteria. But but if anything breaks this pattern anywhere in any system, from head to heel, anywhere, when the growth of cells in a normal pattern is not maintained normally, it grows excessively. It changes their route, changes their way, path of development, changes their boundaries. So ultimately, all those conditions of the cell change are known as cancer. So this is the best definition I can give you about the cancer. That cancer, in a short term, uncontrolled growth of the cell is known as cancer. Because I told you, just like about my fingers, even about all other organs, every organ has its limited growth, every organ has its limited height, wide, everything. In every body, there every organ has a specific type of growth, length, height, everything. But if in any person this pattern is broken, this pattern is you can say it's not maintained by the cell. Just like, the cells are dying, the life of a cell which is created today, The life of the cell is 120 days. And after 120 days, the previous cell will die, and till that, new growth will be capable of taking his place. Step by step, it's coming up, dying, new cells are taking their place, and in this way, this whole system is going on in a normal pattern. And this normal pattern, if it is broken, if it's broken and is not maintaining the normal size and shape, development of any organ, it's called cancer. Genetically, cell grow and die, it's a normal pattern. And everybody has that pattern, that their cells are dying and new growths are coming up, and there is no vacancy. There is no breakage in that one. But in case, if there is a breakage, that is known as marasmus. Sometimes the growth is stopped somewhere in the leg or in any arm, and that organ will go marasmus. Okay, or in this way, when the normal pattern of growth is not maintained, in spite of decreasing, it is increasing in size, increasing in shape, and forget their normal pattern. Forget that this index finger was that high, and how it was high, it was less than the my middle fingers. The same way the ring fingers, same way the our small fingers. So they have their normal genetically factors, genetically set up, that their height will be this much, and this much it will be less than the middle finger, this much it will be from the middle fingers. In this way, we consider that the normal pattern. The same way, all the organs inside the body are maintaining their normal standard. But if in any organ, the liver has a normal pattern, it remains inside the ribs. It remains inside the ribs, right side. Spleen has a normal pattern of development, and under that condition, it remains inside the left side of the ribs. Normal pattern. But if their size develops, it comes out of the ribs. We can see that it's out. We can perceive that, and it's out of the ribs, and it is painful. Plus, the growth of that organ's liver or spleen, just like I give you the example, any organs, is uncontrolled and go on developing uncontrolled, plus its shape and size, because we have a certain level, type of a figure, you can say. We have a figure of the spleen, we have figure of the liver, we have figure of the kidney. All the organs have their definite shape inside our body, inside of every person's body. It's their shape. And if this large development of any organ loses its regular shape, it loses its regular shape, and it looks like the organ is disorganized in the circumference, in the area it is covered. And that is irregular, not in that shape. So that is also called the cancerous development. First thing, enlargement of the organ. Second thing, enlargement irregular, not maintaining the shape. Third, it is invading, because all the organs have their position in any system. In any system, just like digestive system. From mouth to anus, it's a digestive system. if cancer's development comes in existence in any organ, the stomach cancer, intestinal cancers, normally, if there be any problem in the stomach, in the intestines, or in the digestive canal, it will develop symptoms of the digestive system. Most of the symptoms, inflammatory conditions, most of the symptoms will pertain to the digestive canal. But if at any instance this digestive system or any organ of the digestive system is developing and breaking this pattern, that its systems are not only concerned with it is concerned with the same system, but it is not only concerned with the system of that particular system of the body or the organ of the body, it is harming or interfering in the boundaries of the other organs, the boundaries of other organs, and interfering in their function as well. This is a cancer. So, cancer is a different kind of development of the cell which do not follow the normal pattern, genetic pattern of any organs of any cell of the body. That is known as, it's a cancerous. Means innovation. Stomach develops any problems, his symptoms will pertain to the digestive system, upward or downward. But if this innovation of the stomach, enlargement of the stomachs, will break boundaries, and close to that is a mediastinum. Close to that is a other different organs, the spleen and liver. Many other organs are closest to the stomachs. And if these innovation is involving the boundaries of the other organs, means it is one thing, it's enlarging in size. It is enlarging in size and it is taking up the boundaries of the other organs, and the other organs are squeezing. Moreover, the shape of this development will be irregular, and irregular shape converted into hard tumor. It's a type of the hard tumor type of things. Okay. Or second thing, this development, normally the disease from one organ, suppose from the stomach, just like we're taking example as the stomach, from the stomach, this will go to the intestines, or from the stomach, it will go up to the esophagus, nausea, vomiting, all these things, it will go upward, or the downward, it will go to the diarrhea or any problem in the intestine. But if it is a cancer, it will go upward, downward, plus also the surrounding boundaries, number one. And that boundary, it is surrounding, or it is taking up the space of the other organs and neighborhood organs. This boundary becomes irregular. There is this definite shape of the stomach, we know that. But when that normal shape of the stomach is not maintained, it's a cancer. It's known as cancer. So anything which develops irregularly is not maintaining the natural normal pattern of the cell development, that is of the cancer. And the second girl. And second thing we can explain here, that the cancer develops via two ways. One is, first thing is the direct innovations. The second thing is via blood. Blood is taking up garbage back from each and every organ. And when a cell becomes sick, just like cancerous or any inflammation or degeneration or anything, It's not still cancer. The garbage is taken up from these cells back to the circulations, and the nature wants that this should not go to the other organs. Then it filters from that blood, which is coming from each and every sick cell back to the circulations in through the veins. It goes through the veins, you know all that one. And then the veins filters this toxins at a different places. That is known as lymph channel. And lymph channel, if it becomes full with toxic contents, garbage coming from the damaged cells, at that conditions, these lymph nodes are swelled up too tight, just like you put a more air in the football. Ultimately, you will not be able to press that. It will become hard. It will become more hard. More content will be accumulated inside that cell. That's a lymph node, and then it will become more hard and more painful. So in this way, second thing, shape. Always remember, wherever that garbage will go, shape of the organ will not be maintained. Shape of the organ will become irregular, irregular shape, and also the hard tumor type shapes. You can feel it. First of all, just like you press your stomach and you cannot feel there is a stomach. You press your liver and you cannot feel that liver. But when you have this kind of conditions and development or irregular development, that's cancer, because development will be normal. It's not necessary that always the development is a cancerous. No. Development, normal development will maintain the shape and size. Size will increase, but shape will remain maintained. But when it is cancerous, shape will not be maintained. That shape of that organ will not be maintained. It will become irregular shape. And nowadays, it is considered this kind of development. It's the second major cause all over the world. It's the second major cause, the death of the persons. People are dying with cancer because there are different kinds of cancers. And there are different kinds of cancer, but there are some common symptoms which I'm telling you that they can develop. So, the development, first of all, in the surrounding systems, surrounding organs, second, through the blood, third, through the lymph channels. So these are different kinds of, it's not contagious. It is, remember, there are many more diseases, chronic diseases, just like tuberculosis and many other things. They are contagious. Flu, all these things are contagious, but this is not contagious. Pox, etc., those diseases are considered as the contagious diseases, can infect the other persons. If one person is suffering from these conditions and anyone come in contact to them and their vitality, immunity is weak, then they may suffer. But the cancer is not that kind of things that if you touch, if you are in contact with the sick person of the cancer, it will suffer. No, you will not suffer from that one. It's not that kind of thing. Second, other things. When this disease travels through the blood or lymph channels and develops the similar type of conditions criteria in faraway organs. Suppose stomach is close to the spleen, spleen is close to the liver, spleen is close to the mediastinum, close to the other omentum, many other organs, lesser sac of omentum, greater sac of omentum in the stomachs, and also the underlying kidneys and all that. If it develops to the neighborhood organs, This is the one type of pattern. Consider enlargement may be more and more, but the shape is normal. That may be a kind of obstruction inside the organs, that its garbage is not being discharged in a normal way, and the size of the organ is enlarged. But the shape of the organ will be maintained. Whereas when the shape is not maintained with the enlargement of any organs, this is one thing. How the cancer is developing, this is one thing. The shape of every organ which is affected with the cancerous type of cell development, shape will not be maintained. Second thing, it develops through the blood, because garbage is going back to the blood into circulations, and when it is going to the circulations, ultimately it spreads to the other organs. Third thing, lymph channels. When it goes to the lymph channels, these are all the hurdles that it should not go, it should not go, it should not go anywhere. But when these hurdles are crossed and through the lymph channels goes to the other organs, then this is known as metastasis. For example, a lady is having uterus cancer of the uterus. Ultimately, it is not controlled. Ultimately, it is gone to the circulations and ultimately to the lymph channels, and ultimately we see nodes are developing in the lungs. Nodes are developing into any other organs. It indicates that this condition of the cancer is known as metastasis. And metastatic tumors are formed on different places where there is a channel of lymph channel, and these tumors are formed. So these tumors may be solid tumors or may be different kind of tumors, but their shape is always hard, their shape is always irregular, their shape is painful. All these things will be there. Blood, this cancer types, mostly, sometimes it's a blood cancer, sometimes it's a lymph cancer, sometimes it's a localized one organs, prostate cancer, uterine cancer, breast cancer, different kind of organs cancers. But after that, sometimes some of the cancers types are mixed type of cancers, when they involve the other organs, and those organs are also developing that type of criteria, that they are not maintaining their normal development pattern of the cell development. They also lose their pattern, and their shape also becomes irregular when one or more than one organs are involved with this development of the cells, which is irregular, hard, painful tumors. Then that's a different kind of other stage of the cells. And just like if it's blood, in the blood, we call it leukemia. But if it involves the glands and different other organs, that is lymphomyeloma, this kind of conditions are called, or different squamous cell carcinoma, lipomas. Lipomas are acute conditions. There is no cancer type of things. But if any lipoma, any tumor, any warts starts developing irregularly, there is a mutation of the cells, there is a cell divisions, cells, whatever the tumor is, cells are dying, new cells are coming up, cells are dying, but their shape remains regular, and mainly maybe the you can say painless. Sometimes just like in the throat, if something is happening with the thyroid gland, and sometimes it is painless, but whenever you lie down on your back, the pressure of the goiter is pressing upon the respiratory system, it may be painful. But if it's not like that, then normally all the lipomas, all the tumors are painless, and there is only pressure symptoms. If ever they exert pain pressure on any vital organs, and then vital function of the vital organ is not normal at that time, because of that pressure, this kind of symptoms may be. But this is not considered as cancer. But when the shape of the organ is converted into irregular shape and itself is a painful and ever increasing pain, then that is a cancer. And carcinosarcoma, adenosquamous cell carcinoma, these are various type of conditions. Nowadays we are giving different names to that one, that this is the cancer, this is the cancer. So as a homeopathic concept, I would like to tell you that our concept is to treat that this is a tissue change, this is a cell development change, how the cells patterns is going on, it's not normal, and we have to bring just it depends upon the metabolic rates, it depends upon the metabolic rates, anabolic and catabolic rates. Anabolic is now more increased at that area, and the cells are developing in a larger speed, more speed as compared to the normals, and they are developing 2 to 4, 4 to 8, 8 to 16, 16 to 32, and this way they are developing. Then it is cancerous. Now, these all things are mostly we are diagnosed in the hospitals. But even then, there are many more signs and symptoms that we can recognize. We can recognize before going to the hospitals that there may be something wrong, and we can take preliminary steps to control the conditions, just like fatigue, weakness, unconditional. Suppose if you have worked hard and you have weakness, ultimately you take a rest for one day, and next day it will be okay. Fatigue from anything which normally you know the cause of that fatigue, and now you have stopped that thing, and ultimately within a short while, a specific times, you will recover from fatigue. That's not a cancer. But when you see, I have done nothing like that, why I am feeling weakness? It's a serious thing. When there's no cause of fatigue, tiredness of the body, even with the normal functions and even without normal functions, you feel tired, it's a serious sign, it's a serious concern. You should go to the doctor to check in the preliminary stage. Second, fever. Sometimes when the inflammatory condition is past there and it is going to the degenerating conditions, I told you about the cell changes, inflammation, degeneration, necrosis, and gangrene. These are the stages of deterioration of the cells. And when it passes to the degeneration type of conditions, so anywhere inside the body, though it may not be cancer, it may not be cancer, but ultimately it is accompanied fatigue, accompanied with fever, and these two symptoms are associated with loss of appetite, loss of appetite, and night sweats. There are a few diseases just like tuberculosis, it has night sweats. Many other autoimmune type of conditions, they have night sweats. But cancers is also have night sweats. fatigue, fever, loss of appetite, night sweats, followed by pain. All these things are indication of the cancer stage. And mostly skin changes. The discoloration of the skin in a different way, which is not the normal pattern of skin. I have my skin, everybody has their skin, this is a normal pattern. And when the normal pattern has changed, leukoderma, fulberry, or white spots on the skin is a different thing. That's a different thing that I will explain later on what is. But when the pattern or the color of the skin is changed with molds, with warts, tags, it is always considered not normal. Not normal. And especially when they start paining, when you feel pain of those things, that is not normal. Even a mole, a wart, or any skin tag is with you since many years. It was not painful. You are not having any problem of that one. But once you start feeling, oh, it was wart on my wrist or on my hand or somewhere on my neck, or most of the people are having warts on the neck or on the face or anywhere, genital organs, they are not painful. But when they become painful, along with other symptoms, pain, night sweat, loss of appetite, fatigue, all these things are associated with this thing, then this change of mole or painful condition of the mole or tags is not normal. And along with all these things, weight loss. A person is losing weight when there is no condition. I was normal, eating normal, the same way I was eating, same thing I was doing. Ultimately, this is the one symptom. At this time, there is no pain. There's nothing, this type of condition that you can recognize of the pain, moles, and all that one. But ultimately, with the fatigue and a loss of appetite and a loss of weight, loss of weight, you see, unconditional. There's no cause. Every month you check, it's losing. Every month you check, the weight is decreasing. It's of serious concern. And along with this one, if there is a low HB, hemoglobin, that pattern which carries the oxygen to supply to all the cells to be healthy or functionable, that's the oxygen. And that is carried by the hemoglobin, red blood cells. In the blood, there are two types of cells, white cells and hemoglobin red cells. Red cells are non-nucleated cells. They are not having any nucleus. All other cells are having a nucleus. And they're performing, their functioning, their construction, structure, and everything is according to the other cells. But this hemoglobin, which is a empty wagons to carry the oxygen, to supply it throughout the body to all the cells, oxygen, so that they can work normally. And loss of that hemoglobin, normal content is 14.5 gram percent hemoglobin. But when it is decreasing, decreasing with loss of weight, all these things happens. These are the signs of cancer. You should be curious about that one. Take immediate steps, go to the doctor so that you can get checked your all body wherever these are, so that you can get it treated in a timely fashions. And sometimes with the with the cancer of the internal organs, you can feel hematuria, blood and urine, blood and stool. All these things can happen, even blood and sputum. If the cancer is on the upper respiratory areas and respiratory areas, you will have blood with your sputum. Sometimes it's not always, because there are many more other conditions. Even tuberculosis is not a cancer, but you may have sputum, blood with sputum. There may be any throat, any tonsils, inflammation, and all that, and the sputum is coming up, and that may be involved with the blood. That's not a cancer. You have to identify this thing, that without all these conditions, there is no sore throat, there is no tonsil inflammation, there is no any respiratory kind of conditions. But if something comes up, it is bloody, vomiting, bloody. Normally, if you vomit it, we vomit froth, we vomit contents whatever we have eaten. But if you vomit with froth and bleeding, blood comes with the hematemesis. That is serious thing. That is serious thing, but it should be individualized. That suppose if there be ulcer inside the stomach and you vomit, blood may come up with that one. That's not a cancer. Cancer is when this hematuria, when this hematemesis, blood with vomiting, comes with all other symptoms: fatigue, loss of weight, pain, low hemoglobin. All these things should be associated. So these are the necessary symptoms which should be associated with this one. And when you see this kind of conditions associated with the pain, with the development of irregular development of the organs, with the development of lymph nodes and all that, as you feel different kind of pains, and that pain is hard tumor. In any way, you feel pain somewhere in the tumor, and that tumor is irregular in shape, and ultimately many these type of conditions of weight loss, hemoglobin low, appetite loss, skin changes, and fatigue, all these things are associated with this vomiting and all that. It is cancerous. It is cancerous. You should take immediate steps, whatever you can do, so that, because the pattern of development of the cell has uncontrolled now. It's not controlled, because control is genetic. Our development of the body, development of each and every organs, development of ratio of one organ to the other organs, everything has a genetically decided. And if your body is going in that pattern, that whatever is developing in a normal shape, a person becomes 5 feet, a person becomes 7 feet. Yes, their organs will develop according to that pattern, because that pattern and ratio between organ to organ, a ratio between the size of the organs to size of the organs will remain same. The shape of the organs, shape always will remain same. The liver has a shape, stomach has a shape. If a person is 5 feet, even then it has a shape. If a person is 7 feet, the stomach has a same shape, liver has the same shape. That shape will develop in the same pattern. But when, irrespective of these conditions, any organ start developing without any pattern, and that development is breaking the barriers of the surrounding organs, because they are not concerned with their system. Just like I told you about the digestive systems, from mouth to anus, it's a digestive system. If anything is concerned with the digestive system, it will go through the channel from mouth to anus. Its symptoms will be associated with that one. That's the digestive problems. But when any organs of the digestive canal is harmed with the canceric development, in that conditions, it will break up the boundaries. Its boundary is not that it will go towards the anus or towards upward towards the mouth. No, their symptoms travels in the surrounding organs, and they break the boundaries. When they break the boundaries, then it's a cancerous. Development of any tissue, uncontrolled development of any organ, irregular in shape and pattern, this is a cancerous thing. So always remember all these symptoms of the cancer. So that if you see cardinal signs, pallor of the face, because there is a low hemoglobin, pallor of the face, anorexia, loss of weight, low hemoglobin, associated with pain, associated with the night sweats, and different kind of tumor developments inside the body, or development of the moles and tags that are all over the body, or if they are since long but now they start paining, these are the signs of cancers. So whenever you see these kind of signs, be aware and go to the doctors immediately to check up, to find out where this cancer is, from where it has started, and then try to find out the reasons behind that. But if you come to a homeopathic doctor, a qualified homeopathic doctor, then ultimately we do not say, yes, to let you know, I can say that I know cancer. To let you know, or even you want to know about this thing, that Dr. Ji, do you treat cancer? So to reply to you, I can say that yes, I treat cancer, because I do not think a separate thing to the cancer. I see this is a stage of development of the cancer, of the cells, which may be normal, which may not be normal. And the abnormal development of the cells, when it breaks the boundaries, when it changes the pattern, its genetic patterns, that's cancerous. And we have the treatment symptomatically to treat all these type of conditions. And I'm hopeful that I will do all these things. If ever you have any these kind of symptoms, please call me at 408 687 1899. If you want to take second opinion of you, but wherever you are getting treatment, it's okay. But if your treatment is going in a normal pattern, I can guide you that yes, the treatment is going normal way. What is the nature's way? When there was no doctors, no medical science, even then the people were suffering and people were curing. They were getting their health back. How it was? We have studied those things. How the nature was curing the diseases. A person becomes sick. It was a normal routine. It's a sign of life. Okay, in the winter he will feel winter, in summer he will feel heat, in different criteria he will feel different changes. So this is normal pattern, sign of life. But that sign of life, when is aggressive, when is painful, when is disturbing your life pattern, that is not normal. That's a disease. And how the nature was curing all these patterns, we have studied that. And if ever you want to get your opinion, second opinion about your disease, I can guide you whether your treatment is going according to the nature's process or is not going according to the nature's process. This is what I can guide you. And even if you want to be treated by me, by a homeopathic scientific approach of these kind of symptoms, yes, please. Welcome, and I will call. You can call me at 408 687 1899. If ever you cannot call me, you can email me with your concern, and we can discuss. And you will get the answer. That is homeo medicine. HOMEOMEDICINE at yahoo.com. So anytime you can call or you can send email regarding your health concern, and you can get your answer what to do further, what we can do further to save life for all these things. So this is about the cancer. It was your question. That is why after breaking my regular series of lectures, I give you the detail about the cancer, what I know about that, what is cancer, and what are the types of the cancers, what are the symptoms of the cancers, and where question of treatment is concerned, I told you we do not consider it cancer. It's a different stage of development, irregular development of the cells, uncontrolled development of the cells, and that we have to break it. That we have to break that pattern. It should not go that much speed. It should have normal limits. So that's why we consider in a different pattern these cells. So Rabaraka, God bless you all. We'll see you tomorrow with new lecture, with the same lecture. Basically, I have to deliver this lecture in Punjabi as well, because this was the today's time was the English times. Then I will deliver it in Angrezi, English, Punjabi, and then with Hindi, so that every person should know about the cancers. And then we will continue our routine pattern of lectures, series of lecture of health education. Thank you.